Hi, I'm Dr. Hilary Heschauer from Rangeline Chiropractic. Are you in your 40s or 50s and suddenly you're noticing some changes in your body? Women, do you have things like hot flashes? Do you have trouble sleeping, more aches and pains? You might be experiencing perimenopause. And guess what? Chiropractic care can actually help with the perimenopause. Um, there are a couple of us in the office experiencing symptoms like this. So let me tell you, I've got a lot of patients. And on a personal note, I'm going to explain some things and tell you how great chiropractic's even been for me as my patient and as the doctor. But perimenopause is really about this like transition leading up to menopause, right? Like we've heard of menopause, but have you heard of perimenopause and have you thought about if you might be in it, right? Because it seems to me that the women that I've talked to lately, friends, colleagues, family, patients, that it's starting earlier than perhaps our grandmothers had it, etc. And it can last for years while the hormone levels try to regulate and they shift to different things. So women like us feel like our bodies aren't working the way they used to, right? There's these little things, we're irritated, but some of the symptoms that you may have heard of and or experienced these currently are like hot flashes, mood changes, sleeping disturbances, and the sleeping could be even from having the hot flashes, right? But things like headaches, increased stress in your life, and then joint or muscle pain. So things like this where it's just you don't feel like yourself anymore. And so if I have a patient, for instance, that is coming in with more aches and pains in joint and muscle pain than normal, and I've known them for a while, and I might be asking things like, how's sleeping been, right? Do you have extra stress? Yeah, I'm always stressed. I've always have a headache now. And I think to myself, that's weird because you didn't always have headaches like this and your spine wasn't always this misaligned. Like, what's going on? Sometimes it is the hormones, right? It's the hormones. We just need to assess and figure this out. But chiropractic comes into where, yes, menopause is all about hormones, but it's actually chiropractic is not just about like the back, neck, joint pain, headaches. Chiropractic's about your whole nervous system and regulating and optimizing like your body naturally. So when we have this normal change of us women moving into this perimenopause and menopause states, what we really need to do, in my opinion, is work on optimizing our body to the best it can. Now, whether or not that includes changes in hormones and anything naturally like that, that's not what I'm talking about today. I'm talking about getting your nervous system in your body to function and work the best it possibly can. And that's where chiropractic comes in. When your spine is aligned, your nervous system is turned on. It's communicating 100% with the rest of your body. It's communicating with the organs, especially the organs that are helping to produce these hormonal regulations that are going on in our body, right? It also can help with energy. So when we are aligned and our nervous system is functioning at 100%, our body is functioning at 100%. And when we're not in alignment, we're not functioning at 100%. And then we might be experiencing even more symptoms than we need to, let alone the hormone changes. So it's not that chiropractic is changing the hormone balance, but it is really optimizing your body to work the best it can. So I'm not here to say that chiropractic is going to cure menopause. No, but I wish. But it's just about, alleviating some of the tension in your body, getting you to sleep better, reduce your headaches, because chiropractic is great at all of those in general. And if you're experiencing more of these because of perimenopause and menopause, chiropractic is here to help, right? Like I said, we're not going to change the levels of your hormones, and if you need that, we've got people to refer to you for. But Even supporting your posture better as you age, things like that, chiropractic can help with. Things that we can do to have less muscle and joint pain to really help you through this transition. So, think of it as the body needing maybe a reset and allowing your body to adapt to this phase of life better, right? It's never going to be perfect, so to speak, but what can chiropractic do to help? There's a lot of things we can do. Mainly, we need to get the nervous system functioning at 100%. So, again, we are here to help at Rangeline Chiropractic. If you're not local to Carmel, Indiana and Zionsville, Indiana, where our offices are located, I would be happy to help you find a chiropractor. If you need, just reach out to me. But just know that you don't have to do this alone. A lot of us chiropractors are female and we're here. And I love my female chiropractic patients. They're my favorite. We all understand what we're going through. I'm here to help, to listen to it and be like, yes, you are not crazy. You are experiencing all of this. And those dang hormones, I know. I do know personally. So, here to help you with every stage of your life. And reach out to us we're on Facebook, Rangeline Chiropractic. We're Instagram at Rangeline Chiropractic, and would love to help in any way we can. My website is rangelinechiropractic.com. So thanks for listening today. Reach out to me if you have any questions.